it was established that the AstraZeneca vaccine does not prevent mild to moderate disease of the 501Y.V2 variant. This timely finding has ensured that all the measures are taken to utilize the most efficacious vaccine in our vaccination strategy. All the vaccines were developed on the basis of the original SARS-CoV-2 variant, which was the prevalent one during the whole world. So everyone used the same structure of that variant. For most of the year, this was the most dominant one. The government's processes of procuring vaccine preceded the discovery of the 501Y.V2 variant and other variants that have since emanated from different parts of the world. Given the outcomes of the efficacy studies, the Department of Health will continue its planned phase 1 vaccination, targeting the health workers using the Johnson & Johnson vaccine instead of the AstraZeneca vaccine. The Johnson & Johnson vaccine has been proven effective against the 501Y.V2 variant, and the necessary approval processes for use in South Africa are underway. The rollout of the vaccination will proceed in the form of an implementation study with a partnership between the Medical Research Council and the National Department of Health vaccination sites across the country. This will now help us to provide valuable information about the pandemic in the post-vaccination community, and thus ensure early identification of breakthrough infections should they occur amongst the vaccinated health workers. I believe that we will be able to start sometimes next week, and I'm not in a position to give the date because that has to be released from cabinet, and so that matter is being refined. Now, there are concerns in the public domain about the expiry date of the received AstraZeneca vaccine batches, which was 30th of April 2021. The vaccines actually have not expired. I think it's important to just underline that, because when the issue of expiry is being raised, some people think it's already expired, and in fact, it must have been administered to people when it's expired, and that's not the case. In addition, in keeping with the original vaccination plan, if the Department of Health were to have proceeded with the AstraZeneca vaccine rollout, these doses would have been used up by the expiry date. In other words, the expiry date would not have been affected at all, because we would have started the vaccination and we're targeting at finishing them anyway long before that date.